is jaundice. As we all know, that jaundice is the yellow discoloration of the sclera, skin, and mucous membrane, which basically results from an increased bilirubin concentration in the body fluid, which we can say more than 3 milligram per deciliter. In medical sciences, it is a very important topic for examination because if the patient may have acute or chronic liver disease, congenital hyperbilirubinemia, hemolytic anemia, or recurrent jaundice. So, if we talk about the mechanism of jaundice production, so in we can say increase of bilirubin in blood may rise in four different ways. The first one is the overproduction of bilirubin. The second might be decreased hepatic uptake. Third one may be decreased hepatic conjugation, and the fourth one is a disturbance in the excretion of bilirubin. Mostly the overproduction of bilirubin increase in hemolytic states like malaria and other hemolytic conditions where the increased bilirubin load uh, cause jaundice. And the second one is decreased hepatic uptake. This basically occur due to disturbance in process by which the bilirubin diffuses into the cell from the sinusoids and is actively transported to the microsome for conjugation. The third one is the decreased hepatic conjugation. This basically because of the disturbance of bilirubin conjugation. For example, due to the deficiency of enzyme which conjugate bilirubin. And the fourth one is the disturbance of excretion of bilirubin, which may result from intrahepatic dysfunction or extrahepatic mechanical obstruction. Intrahepatic cholestasis, which is the difficulty in canicular transport of bile from microsome to main bile ducts. That may be in case of viral hepatitis and due to effect of some drugs. And the other one is the extrahepatic cholestasis, which basically due to the obstruction of main bile duct due to common bile duct stone, carcinoma of head of pancreas. So we divide the jaundice, the causes of jaundice into following types. The first one is hemolytic jaundice, second one is the congenital hyperbilirubinemia, and the third one is cholestatic jaundice, maybe intrahepatic or extrahepatic. So today I would like to elaborate what is hemolytic jaundice. Basically, the hemolytic jaundice result from increased destruction of red blood cells, which ultimately result in increased bilirubin production. When we talk about the causes of hemolytic jaundice and what causes the hemolysis in the body, so there may be some extra erythrocytic abnormalities or intra erythrocytic defects. So first of all, I would like to explain the extra erythrocytic abnormalities, which includes malaria. This may be autoimmune, physical trauma like burns, prosthetic heart wall, etc. Chemical trauma like drugs, and metabolic in case of uremia. And when we talk about the intra-erythrocytic defects, this includes thalassemia, enzyme glucose 6-phosphonate dehydrogenase deficiency, and the vitamin B and folic acid deficiency. The clinical features of hemolytic jaundice include the following like jaundice, which may be mild because the healthy liver can excrete a bilirubin load 6 times greater than normal. Bilirubin basically is not more than 4 to 6 milligram deciliter per deciliter in uncomplicated hemolytic anemia. So if the bilirubin is more than 6 mg per deciliter, then there is a concomitant hepatic injury which is cause the jaundice. The patient may be paler due to anemia, splenomegaly due to excessive uh, RBCs, hemolysis, and the stool of the patient will be dark due to excessive stercobilinogen, which is produced by bilirubin. And also, if we talk about the urine color, and it will be dark due to increased urobilinogen. When we perform investigation, so we go for LFTs. Plasma unconjugated bilirubin is usually raised, but less than 6 milligram per deciliter. Other liver enzyme like AST, ALT, alkaline phosphate, and also albumin are normal. And when we talk about the other investigation, we perform urine examination, and there is no bilirubinemia because the hyperbilirubinemia is unconjugated, which is not water soluble and therefore cannot pass into the urine. So when we talk about the urobilinogen, so there is increased urinary urobilinogen in urine examination, and when we perform ask patient to have CBC, then we came to know that the patient have the low RBC count, highly reticulocyte count, and the serum hepatoglobulins are low in case of hemolytic jaundice. So that was all about a brief introduction, a brief elaboration of jaundice. Hope you all get it what I uh, discussed in today's lecture. So thank you so much.